Hi guys, welcome back to my channel As Told by Muriel. I am Muriel and I want to start off by saying happy Nurses Week to all the nurses out there. A happy Teacher Appreciation Week for all my educators out there. On today's video, I am going to talk about some of my pet peeves in nursing as far as nurses are concerned in long-term care. Stay tuned. Okay guys, so I have a list I got a lot of pet peeves, but I'm gonna narrow it down to 5 pet peeves I have when it comes to nurse-to-nurse interaction in long-term care. Pet peeve number 1. Okay, we are trained in school. Well, I know when I went to school, I was taught that you leave a med cart stocked for your oncoming nurse. You clean the cart, you stock the supplies, the cups, the straws, insulin syringes, the stock meds. You leave your cart stocked for the next nurse, nice and clean, wiped down. My pet peeve is not so much concerning cups, spoons, things like that. I don't know why, but when a nurse leaves her trash on the med cart, it burns me up on the inside. I don't understand how you can work a cart and have the trash that you accumulated, because that is your cart for your shift. So this is your trash. You accumulate it. And then you're just not going to dump the trash before you give the cart to the next nurse. You may do everything. You may stock the cart. You might wipe it down. You might do all these things. But for some reason, you will not pull your trash. And y'all, this is a pet peeve of mine. I work behind a nurse who would not take her trash. And I said, I don't know. In some facilities, housekeeping will come and grab your trash from your cart as they're doing their rounds. Sometimes even your aides will come and grab the trash and change the bags out. I've had it happen where like I'll go whatever and come back and someone has pulled my trash, and I appreciate it, but before I give my cart to another nurse, I'm going to pull my trash, and there's going to be a fresh trash bag along with a stock cart waiting for that nurse. I just don't understand how you can leave. It just makes me think all kind of things about you, even when it comes to your household, when you leave your trash on the cart and try to, give this cart to the next nurse. So yeah, that's my pet peeve number 1. Pet peeve number 2 when it comes to long-term care is when a nurse is working a cart. Say, okay, I've had this happen so many times, and it's not just particularly one nurse. I've gone and relieved nurses. I'll go on the floor that I've never worked before to relieve a nurse, and this is mainly on the rehab floors. I see this, and there'll be a patient who has been there for like 3 days, even if they've been there 2 days, and there's medication on their medication administration record that isn't on the cart. And so I'm like, okay, so this patient has been here for 3 days. This medication is popping up. This medication is not on the cart. They don't want you to put medication not available when you're charting it. Say, for you new nurses out there, if you encounter this, no facility wants you to document that a medication is not available, even if the medication isn't available. So in order to get around this, if there is a medication that's not available, but the doctor doesn't want to discontinue the medication, say their pharmacy has to get it from wherever, back up, or however, whatever the reason why this medication isn't available, call the doctor and ask the doctor, can I get an order to hold this medication until available? Everything you do has to be backed up by a physician order. So the fact that a patient can be in a facility for 72 hours and this medication can keep popping up on their MAR, and no one took the time just to get an order to hold that medication. Y'all, I don't understand it. I've worked with patients who have had narcotic orders for pain. They are post-surgical or whatever the situation may be, and they come into the long-term care facility. And it's ideal that the doctor from the hospital will send a prescription with the patient for a certain medication. But if by chance that doesn't happen, when this patient comes to the hospital and they're post-surgical or they're whatever's going on and they're having pain, even they're a cancer patient, you know, anything that can cause pain, and we have an order for them for Tramadol, because you know Tramadol needs a prescription now. Back in the day, you didn't need a prescription for Tramadol. Oxycodone, per any controlled substance. Not even just controlled substance, y'all. Any medication. Any medication. And this patient has been here for 2 days. And his medication is not here, but it keeps showing up on the MAR. Please just get an order from the doctor to hold it until it's available. Because if I'm just encountering this today, say it's a 9 a.m. med, I'm doing my med pass, and this medication pops up and it's not there, what am I supposed to do? You know, what I'm going to do is I'm going to call the doctor and be like, hey, can I get it? And I might not call the doctor right then because I'm in the middle of doing my med pass. I got 20 patients I got to pass meds to. I can't stop and call the doctor right now because I don't have this medication. But once I finish this med pass, I'm going to call the doctor and be like, hey, this patient came in, blah, blah, blah. This medication is not here. Well, the very first thing I may do is call pharmacy and see what's going on with the medication, because there are times that pharmacy would be like, oh, we don't have a prescription for that, or, oh, we don't have that medication, you know, things like that. So when you call the doctor, you can know what to tell them. Hey, I don't have this medication, we need a script. Or, hey, I don't have this medication, pharmacy doesn't cover it. Do you want to change it to something else? Or, you know, whatever. Take the time to call, get that clarified. Don't just keep letting it go on and on. And I worked with a patient who came in post-surgical, had an order for Percocet, and person had been there 3 days and nobody had even addressed the fact that this person don't have pain medication. They just kept giving the person Tylenol for post-surgical pain, y'all. And that's what kind of really pisses me off about rehab facilities when it comes to new admission. The medication is always, just 85% of the time, the medication just screwed up. Pet peeve number 3 when it comes to nurses is that nurse who goes in and changes all the times on, who goes in and changes times on medications so that they're not having to administer medications on their shift, and they put it on your shift. Y'all, I know day shift. I know day shift. It's a lot going on day shift in a long-term care facility. But why would you move a Lasix from, which a Lasix is a diuretic, it's a medication that's going to make people, you're going to pee. Why would you move a Lasix from 9 a.m. to 5 p.m. or 9 p.m.? I don't understand. What sense does that make? Why would you move a Prilosec from 6:30 a.m. to like 5 p.m.? Normally medication will say Q day, QHS, Q twice a day, something like that. If you're going to give a Prilosec, why are you scheduling it after someone has already eaten? Leave that as a 6:30 a.m. med. Some things just, I just don't understand. Why are you even altering things anyway? What was wrong with the way it was? Like, why do you come in changing around times on medication? I really don't. I don't understand why nurses do that. And that's a pet peeve of mine. It's not a real big issue, but it's just a pet peeve of mine. Pet peeve number 4 when it comes to long-term care. Y'all, if you're going to be late, and I know because I have been late to shifts, not just once, not just twice, not just 3, not just 4 times. If your shift is supposed to start at 7 o'clock, why are you calling at 7:10 to say, I'm running late, I'm going to be 30 minutes late? It's 7:10. You knew when you walk out your house at 6:45 and you were heading somewhere that's 50 minutes away, that you are not going to be on time from work. Why wait until 7:10, 7:15 to call and say, hey, I'm going to be about 30 minutes late? Call at 6:45. when you leave your house, or call when you wake up and you know you're going to be late, because that gives the nurse that's waiting on you a heads up of like what's going on. They may have things they need to plan in their life. Like me, when I worked night shift, I had children that had to get ready for school. Like, I was banking on at least, I think at that time the school was starting at 8:45. I was supposed to get off at 7. I was banking on being out of there like at least by 7:30. I was worked like 15 minutes, 20 minutes away from the job. Being home at least by 8 o'clock to get my kids ready and get them around the corner to their school by 8:45. Like, there are parents like me who bank on, if not leaving on time, because leaving on time in nursing is not always, feasible, but at least leaving by like 7:30, 7:45. I personally give everyone a 15-minute grace period, because I know how it is, and I'm occasionally late, but I always call to say, hey, I'm going to be there about 7:15, and I don't wait till 7:05 to call. I don't wait till 7 o'clock to call. I call like as soon as I walk out my house, as soon as I wake up, and I know I'm going to be a little late. Because people have things they have to do in life. People have places to be, things they need to do. They might have to make, other arrangements, because instead of getting out of here at 7:30, I might not be getting out of here at 8 o'clock. So let me call ahead to my house and, tell one of my other children, hey, I need you to go ahead and get him dressed. So he'll, my son dressed, so he'll be dressed by the time I get home from work. Or at that time, my daughter and my son were going to school, and I would have to call and tell my daughter, hey, when you go ahead and get finished getting dressed, go ahead and dress for me. So when I get there, I can go ahead and take you out of school, because I'm going to be running late. Like, a little bit of common courtesy, that attendance and time thing, it is horrible. When it comes to nursing, and the nurses have no regard for the nurse that they're relieving. Some places have a system where the nurses know that the person always comes like 45 minutes late. So it just is what it is. But when you're working, like, I'm an agency nurse, I don't have that understanding with other nurses. Like, I don't have that understanding that you come 45 minutes late for your shift. So, that's one of my pet peeves. Not necessarily being late, but calling after the time your shift is supposed to start to tell me you're going to be late, or even later than what you are. And my 5th pet peeve in nursing, when it comes to long-term care, this might sound, because I know a lot of nurses are guilty of this. When you're a nurse in a facility, these facilities have you spoiled with assigning you to a certain hall, and you become comfortable with that hall. But when you have to switch halls, why have a hissy fit? Why, moan and groan and complain? And so once they work a floor for like 2 weeks straight, or they work a floor since they've been there, they've been on that floor, the minute they have to go work another floor, y'all, it's like World War III just broke out. That is my pet peeve with nurses. And then if that nurse is the nurse relieving you, then you got to wait for them to, have their fit, and, something, won't even take the keys, won't even report with you, have to talk to the supervisor, go through all this, and end up taking the keys for the car anyway. Like, we could avoid all this. And these facilities will tell you, you're not this is not your hall. You're here for all the patients, but that these nurses will come in, and then they'll whine and moan and complain because they got to work a different home. And so, yeah, those are my 5 pet peeves that I can think about in long-term care when it comes to nurse and nurse interaction. If you can think of any more, leave them down below. I'd be interested in hearing what some of the things you go through in long-term care. And I'm putting this out there for those new students, just to let them know that even though we're adults, we don't always have common courtesy for our fellow co-worker, and you will run into some of these. So I'm just going ahead and go get you prepared for these things. As always, if you like this video, please hit the like button, subscribe to my channel. I'm out of school right now. I'm on a little break actually before I jump into summer classes. So I'm going to try to drop like 3 videos, a video back to back to back, you know how it go. So yeah, like this video, leave a comment, subscribe to my channel, and I will be back if you see me in the next video with the same thing on tomorrow and the day after. It's because I'm recording all these videos in the same day while I have the time. Yeah, so I will catch you guys later. Have a good day. And happy Mother's Day.